how you doing? My name is Don McNeil, and this is my assessment of a newborn. First things first is I'll introduce myself to the parents. I'll provide my patient with safety, privacy, and dignity. Closing the curtain, washing my hands, things like that. I'll be appropriate, talking to the patient and the parent while doing this assessment. So the first things first is I want to take vitals of the patient. So that entails temperature. I would, use the thermometer, put that axillary under the armpit. I'm going to check blood pressure using a cuff on the thigh here or the calf. I'm going to listen to the heart rate with my stethoscope apically for a minute. I'll also get respirations for a minute on placing my hand above the abdomen, looking for those breaths. I'm going to weigh my patient, removing the pamper. But when I remove my pamper, what I would do is I'm going to assess the genitalia of my patient. If it's a female, I want to know if that labia is covering the clitoris all the way. I want to check and see if there's any discharge, anything like that, colors, edema. For my male patients, I want to check for the meatus is appropriate. I want to check to see for the testes if they descended, and I want to check for rugae on the scrotum. Okay, so we'll pamper off, we'll weigh my patient, we'll get the weight, and I'm going to measure my patient from tip of the toe to the tip of the head, and then I'm going to measure the circumference of my patient from around the head, and then from around the chest, I'll measure the chest. Okay. I'll give a general assessment. I'm looking for body alignment, symmetry, things like that, rise and fall of the chest. Muscle tone, I'm listening for that, if my baby's crying, I'm listening to try to see, what kind of cry is going, that she is exhibiting. Next thing I would do is I'm going to move on to the skin. So for newborns, I want to, look for that vernix. I'm going to look for milia. I'm going to look for lanugo. I'm going to look for erythema toxicum, Mongolian spots, and also petechiae. All right, so moving on, we're going to start with the head. For those patients that were born vaginally, I want to check and see about the head, see about molding. I want to check the posterior and anterior fontanelles. I'm also going to check for caput and I'll get this wrong. Cephahematola, all right, and that's the blood under the scalp. Okay, moving on, I'm going to look at the face to see if the face is symmetric. I'm going to look at the ears, make sure the ears are well formed and appropriate. I'm going to look in the eyes. I'm going to check the eyes. I want to make sure the eyes are symmetric or aligned right. I'm going to look for the iris. I'm going to check the colors of the iris. I'm going to check for conjunctiva and strabismus. And I'm also going to check for pearl, that the patient's eyes are equally round and reactive to light. I'm going to look at the patient's nose and make sure that the nose is bilaterally patent. I want to put on my gloves. I want to check the baby's mouth. I'm going to check the roof of the mouth and the bottom, make sure I don't feel any teeth or anything like that. I'm going to check the roof of the mouth, make sure I don't feel any openings in the baby's mouth. I'm going to open it, make sure I see Epstein. If I see any Epstein pearls, make sure I note that. I'm also, while I have my finger in the baby's mouth, I'm going to check for rooting, suckling, stuff like that. I'll ask the mom how she's doing with breastfeeding, seeing if the baby swallows. All right, and then I'll move on to the chest. I'm going to look at the chest and make sure everything is aligned right. I'm going to measure nipples if they're engorged, anything like that. If I feel those buds, I'll measure those. I'm looking for engorgement. I'm looking for any extra nipples, things like that. I'm going to use my stethoscope again to listen to that heart. I'm listening for any adventitious sounds, a murmur, anything like that. Then I'll move on to the abdomen, where I'll inspect the abdomen, rise and fall. I'm going to, for those newborns, I'll look at that umbilical cord, make sure that I see the 2 arteries in the vein. I'm going to also listen to bowel sounds on the newborn, and I'm going to ask the parents about any voiding, meconium, how many pampers a day, etc. And then I'll move on to the extremities. For my extremities, I want to make sure my baby can flex, can lift his arms, make sure that everything's bilateral. I'm going to count the fingers. I'm going to raise the legs. I'm going to flex the legs open, listen to see, if I hear any audible clicks. I'm also going to count the toes. Okay, then I will move on to my reflexes. With my reflexes, I'll perform the Moro reflex, dropping the arms, seeing that startle. I'm going to do the tonic neck, where you turn the baby's neck, you get the fencing on each side. I'm going to do the palmar, where the baby squeezes your fingers, or the fingers are wrapped around your fingers. I'll also do those with the toes. And then I will perform the Babinski, the Babinski move, where you're rubbing the foot and you're getting that flare. I'll turn the baby over and I'll perform the Gallant reflex, seeing that curvature. And while I have the baby over, I'm going to check the spinal column. I'm going to see if I feel any openings, anything like that. And then I'll remove the pamper again, and then I'll check the anus to see for patency, anything. All right? And then after that, I'm going to ask the parents, or if I see anything, the baby has intense crying, or I'm going to ask the parents about deep sleeping, or not sleeping at night, those type of different behaviors. And that would include my assessment. Thank you.